150 children died in this past year due to poverty-related illnesses. 1 in 4 children are currently living in poverty and getting sick, but they can't access the help that they need. Hunger is a massive issue in New Zealand. The government stopped providing food for kids because it is now the responsibility of charities. It is also expensive to purchase food, which makes it hard for low-income families to be able to support their children and buy them the food and nourishment that they require. It is also hard for parents to now access care for their children, as the government is making it harder for them to access child care. For example, nurses and dentists. The nurses are also having a limited time to help prevent illnesses. Because hunger is a major issue in New Zealand, when kids are hungry, they become sick, and then it is the taxpayer's responsibility to pay for them to get better. Illnesses are also easier to catch. Every dollar spent on preventing child illnesses, $4 is saved on health care. Kids under 14 get 10% of the health fund, but make up 70% of the population.
In some parts, yes.
Yeah, definitely.
Yes, absolutely.
I definitely do. I definitely think it's more so now than it probably was when I was growing up.
I think it probably is one of the major issues. It needs to be addressed, and it's a big problem.
Yes and no. In terms of poverty as overall, the term's not associated with places like Africa, where they don't have no food, no water, no shelter, no resources, no education, or lack of to be able to source. So the term poverty is normally associated with on a larger scale, but in terms of New Zealand, you could scale it down to poverty being limited shelter or limited access to money or being able to source your own food and provide for your family. So poverty has many scales, but I do believe it exists in New Zealand. But at the same time, even though you're brought up in a family that possibly has less of a, how can you call it, not opportunity, less of a probability of succeeding.
Yeah, you're upsetting
Who? Howard?
Yeah.
Okay, I'm coming. Okay. Less of a probability of succeeding, but you can always get yourself out of it, and there's always there's heaps of places where they can support you and help you get to where you want to get. But obviously, in terms of places like Africa and places where there isn't none of that stuff, they've got less of a chance of getting anywhere in the world.
South Auckland.
Why?
It's the only time you hear about it on the news. And maybe Christchurch too.
Well, South Auckland, Mangere, Kaikohe, where I come from, Kaio, Whangarei in places, and Dargaville to the back, because I live up there. And I know there's a lot of poverty up there. But many places in New Zealand.
South or west Auckland.
Remote parts of New Zealand and certainly South Auckland, it's pretty prevalent.
In New Zealand, I think on the outer skirts of the bigger cities, Auckland, Wellington, there'll be some in the South Island, Auckland, Wellington, especially around South Auckland, things like that, because there's a lot more people there, jobs are hard to get, and house prices are ridiculous, rents are ridiculous.
Obviously, those who are from a low socioeconomic background that can't support themselves, maybe those who are on the benefit, those who don't have a job, those families that can't support themselves and need other support to be able to survive, which maybe would be areas such as South Auckland, that are in this region, but I wouldn't really know anywhere else other than
Zealand.
I think, not to be all stereotypical, but it's most commonly found in South Auckland.
poverty?
Not really. They've got a number of issues that they, that they really need to work through, and yeah, it needs to be something that they need to focus on a little bit more.
Well, if we're seeing diseases from the 70s, I don't think helping the issue at all. Maybe, if we're like third from the bottom, obviously they're not doing anything that's like of any help. So,
Both.
They've probably got initiatives in place, whether they work or not. I don't know.
Trying to. I would say they're completely preventing it, but I'd say they're trying to.
Do I think the government is doing enough to try and prevent it? No. There seems a lot of programs around trying to solve poverty by throwing milk in schools and bread in schools, but that is not solving the problem. It's actually
I think it's aware of the problem. Are they actually doing enough to fix it? No.
Well, to start with, they're obviously offering some sort of service in terms of the dole or the benefit. So they're obviously giving those families that can't afford their own lifestyle to be able to give, be given such a benefit. But I mean, they could raise such things as the minimum wage, or I don't know, possibly make more opportunities for people to have work in areas that could provide more opportunities for people to go further in their education, or provide things where people can learn, or things that they don't necessarily pay for, but provide it for them so that they can educate themselves to go on further, so that they can help themselves, not just help them by giving them money or resources or something like that.
Poverty is seen all across New Zealand, but mostly seen in places like South Auckland. Families living there are unfortunately living in poor housing, which also contributes to the fact that most of the children living there are ending up in hospitals due to the fact that they have respiratory illnesses because their houses are damp and unlivable. New Zealand government is trying to help families in poor housing by giving them more money, but more money isn't helping contribute to the fact that their houses have mold and are also cold in the winter. Children are being forced into houses that aren't suitable. In 1973, the government had the idea that by helping New Zealanders make money and become rich, then the money would trickle down to the poor. But unfortunately, this hasn't happened, as we can see in today's society. Trying to generate wealth, we're bankrupting our children. New Zealand has become an expensive place to live. $100 can only feed 2 adults, and after paying their bills, that's what most families have to live off of to support 2 adults and 2 children as well. We should have a fair market, not a free market.
To try and ensure that they all have equal opportunities to get themselves out of the poverty, such as access to education, access to medical stuff, access to basic food and shelter and warmth. Those things there. So, for example, if this person here is poverty, it means they can't pay for his tuition, they can't pay to go to university and whatnot, they can't pay for basic food and shelter, so then they get sick, then they can't attend school, and then they don't educate them, so when they don't get educated they can't get into university. Can't get into university, that means they can't get any qualifications, they can't get a high paying job, so it's just going around a cycle and cycle. So we need to break that cycle by ensuring they're educated and have full opportunities for everybody else.
There's probably, from my point of view, there's probably several ways they can do it. Once again, by really looking into the schools and seeing what is happening, why is there that much poverty? Going out to the employment, more employment will probably stop a lot of poverty, but in places, as I said, like Kaikoui and Kaio and Kaitaia, where industry has moved into the cities and left the countries empty, and that's where the child poverty is.
One aspect could be that the under 18s are funded with free healthcare, and maybe go back to the free lunches in schools or the free milk campaign in schools, so at least some children have got something, in their stomach before they go to school and learn.
How can we fix? Oh, okay, that's what you said. It's a hard one. I think first of all, somehow we've got to increase. There's more jobs out for more people, even if it's semi-skilled. The more jobs gives people they earn money for, then at least there's more income in the family.
Well, to start with, it's like a stereotype. So people tend to fall into a stereotype. Like myself, I'm Māori of Pacific Island descent, so many people would look at me and just think, oh, he's just some dumb Māori or dumb coconut. So that's how it is. So you tend to just go along with stereotypes and social norms. Tend to stick to those, and then you stick to these groups, and then by the time it comes around and it's time for you to make money and live a life and support your children that you've just had, it's too late, and people, can't afford to make a living, so they end up on benefit, they end up having no job, no education to back themselves up, and when they want to get them outside of a hole, get themselves out of a hole, they've got nothing to back them up. So maybe supporting youth would be where to start first, in terms of their schooling, education, making sure that because you can't look at the adults and the elderly people, because obviously they're already past that stage. You have to bypass them and start with them, so that when they grow up, they can sort of influence the people around them and distill any stereotypes.
The Kids Can organization help with clothing and shoes. It would be helpful for local doctors to visit schools, fix the housing to prevent overcrowding, or more rental properties that are suitable for big families and can also keep children from getting sick.